working with the manufacturer to confirm the exact doses, quantities, and dates are still to come. The territories will receive their first quarter allocation over the next 2 Moderna shipments. Contending with a number of constraints, this acceleration in deliveries to the north will allow the territories to enable the vaccination of 75% of their adult population in the first 3 months of 2021. The decision was made in consultation with other federal partners, as well as provinces and territories, and is based on communities' limited access to robust healthcare services imposed by their remote and isolated locations. Now, rest assured that at the end of Q1, all provinces and territories will receive their allocation just as they were communicated to them previously. Government of Canada has also purchased an additional 4 million doses of the Moderna vaccine, bringing the total number of secured doses to 44 million. The additional 4 million doses are expected to arrive between July and September. Now, in preparation for this large-scale ramp-up, the Vaccine National Operations Center continues to work closely with provinces and territories and stakeholders to ensure that they have capacity and capability to keep pace with the increasing shipment size of authorized COVID-19 vaccines. Moving ahead, we're expecting to receive 23 million doses from Pfizer and Moderna between April and June. And this is now what our planning is focusing on. So we remain in discussions every day with all our partners to ensure that we're all in sync and have the latest updates for all stakeholders. Alors bonjour, bon matin. À ce jour, nous avons distribué un total de 1,5 million de doses.
Good morning.
Des deux produits autorisés.
To date, we
Pfizer,
have
BioNTech,
distributed
et
a
Moderna
cumulative
à
1.5
travers,
million doses
le pays.
of both Pfizer, BioNTech, and Moderna vaccines to provinces and territories. This week,
650
Canada received 403,650 doses of Pfizer, BioNTech, and distribution, of course, was delayed by the weather on the East Coast. But the delivery should be complete by the end of this week. Next week, we are expecting to receive around 475,000 doses. By the end of February, we will have delivered approximately 1.8 million doses of Pfizer-BioNTech to provinces. The manufacturer has confirmed delivery schedule until the end of the first quarter. As of now, we anticipate receiving 444,000 doses weekly in March. By the end of March, we will have distributed 4 million doses of Pfizer-BioNTech. Last week, Minister Anand announced that the Government of Canada negotiated an accelerated delivery schedule for Pfizer-BioNTech. This means that doses of Pfizer-BioNTech scheduled for delivery in the summer will now be delivered earlier. During the spring, we expect to receive an additional 2.8 million doses of Pfizer-BioNTech on top of what was previously anticipated. As for Moderna, we have distributed over 500,000 doses across the country since December. The next shipment is expected to arrive next week and will consist of 168,000 doses. Moderna, the remaining 1.3 million Moderna doses to round out their first quarter commitment of 2 million doses are expected in March over 2 shipments. We're working with the manufacturer to confirm the exact doses and dates to come. The territories will receive their first quarter allocation of the next 2 Moderna shipments. This acceleration in deliveries to the north will allow the territories to enable the vaccination of 75% of their adult populations in the first 3 months of 2021. This decision was made in consultation with other partners at the federal level as well as provinces and territories, and is based on communities' limited access to robust healthcare services due to their remote and isolated locations. Rest assured, at the end of the first quarter, all provinces and all territories will have received their allocations just as had been communicated to them previously.
The government of Canada
has also purchased an additional 4 million doses of the Moderna vaccine, bringing the total number of secured doses to 44 million. The additional 4 million doses are expected to arrive between July and September. In preparation for this larger scale ramp-up, the Vaccine National Operations Center continues to work closely with the provinces and territories and other stakeholders to ensure they have the capacity and capability to keep pace with the increasing shipment size of authorized COVID-19 vaccines. Moving ahead, we are expecting to receive 23 million doses from Pfizer and Moderna between April and June, and we're focusing on that at this point. We are focusing our planning efforts on that. Every day, we remain in discussions with all of our partners to ensure we are all in sync and have all the latest updates. With that, I am prepared to answer any questions you may have. Thank you.
Merci, Major Général. So we'll now take questions. As usual, we ask that you please limit yourselves to one question and one follow-up. Vous pouvez poser vos questions dans la langue officielle de votre choix. Une question principale et
you may ask the questions in the language of your choice. One question, one follow-up. Operator?
Thank you. Merci. Please press star one if you have a question. Veuillez appuyer sur l'étoile 1 pour toute question. Our first question is from Mackenzie Gray from CTV. Please go ahead, à vous la parole.
Hi there. My first question is for Major General Fortin. In the chart that PHAC distributed, it listed a potential number of Canadians who could be vaccinated based on all of the deliveries of the vaccines that Canada has procured. Can you tell us, for particular the Q2 number, the 24.5 million, what vaccines are calculated into getting that number?
So the chart that was provided, it shows over time the expected cumulative number of Canadians vaccinated. The top row would indicate the number of Canadians vaccinated with the currently approved vaccine, Pfizer, BioNTech, and Moderna. The second line would suggest that additional vaccines, as they become approved and available, consistent with our procurement arrangements, they will be brought on charge and will be distributed and will be made accessible to Canadians. So those are planning figures, an up to number, if you will, and that's the high level that we're planning against with provinces and territories.
I get that, but I'm just looking to know which vaccines you've used in that calculation. So is it Astrazeneca and Johnson & Johnson? Is Novavax included in there? Is Medicago used? Just want to know what vaccines you're using to get that Q2 number.
So perhaps, if you permit, this is Ariane Reza from PSPC. I could answer that question. So as you know, we have 7 APAs that are signed. For the Q2 numbers, it includes, based on pending regulatory approval, 5 of the 7. Medicago and Sanofi would not be coming online as early as Q2. So the 5 that are included in that row, as it relates to the ones that we have with regulatory approval in place, Moderna and Pfizer, and 3 more that are under regulatory review, which are AZ, Johnson & Johnson, and Novavax. Thank you.
Merci. Prochaine question.
Thank you. Our next question is from Charlie Pinkerton from iPolitics. Please go ahead. À vous la parole.
Good morning, all. Thanks for doing this. The New England Medical Journal published a letter yesterday from a pair of Canadian scientists explaining that based on the data that was submitted to the U.S. Food and Drug Administration, that Pfizer's vaccine showed an efficacy of just under 93% after just a single dose. 2 weeks after that first dose was given, the authors of that letter suggest that insisting that people receive 2 doses 1 month apart actually adds little benefit, and that given the current vaccine shortage, that's giving single doses should be the priority. What I'm wondering is if Health Canada and our plan is sort of set on the 2-dose regimen, or if there's any deliberation or study by Health Canada, PHAC, into potentially moving to a single-dose system for this vaccine to speed up the overall rollout.
Thank you very much for the question. It's Dr. New, so I'll take that one. Yeah, certainly the two authors on the New England Journal are good colleagues of ours, and they've actually presented to our special advisory committee as well. These are what I would call early data in terms of vaccine effectiveness studies. And the indications are that there's a good level of protection after just one dose. And this is a certain period of time after receiving that first dose. So certainly as we unroll our vaccines across the country, but also looking at the experience of other countries, more and more evidence is being accumulated with respect to vaccine effectiveness, be it after one dose or 2 doses. And so all that information is being looked at very carefully, being analyzed by our experts as well in the National Advisory Committee on Immunization. And those deliberations and discussions are very live and ongoing right now. Thank you.
Thank you. Follow-up?
So just to sort of follow up on that, it sounds like there's some sort of consideration behind the scenes that this could be an option. Please correct me if I am wrong in interpreting that. This seems like it would be more difficult, moving from a 2-dose regimen to a single-dose regimen than doing something like we've seen with the syringes, simply because of the nature of study involved. Can you talk a bit more about, what exactly the work is that needs to be done by Health Canada specifically to approve something like this? Again, assuming that I am interpreting what you said correctly.
Okay, Dr. New, I can't speak from a regulatory perspective. The official monograph from the manufacturer is for 2 doses based on their clinical data, their clinical trials that were conducted, and saying that there's a certain efficacy based on their clinical trial data for a certain interval, 21 days or 28 days, depending if you're talking about the Pfizer, BioNTech, or the Moderna vaccines. However, as we're now rolling out the vaccine, sort of, as you say, in the real world, more and more evidence and experience is being accumulated. And it is something that is being discussed more from a implementation perspective, but also in terms of, I would say, what is the balance between protecting a larger number of people with the 1 dose as opposed to maybe a smaller number with 2 doses. And the questions raised by the authors, I think, are legitimate ones. Would sort of 2 doses and the incremental, let's say, whatever the difference is, the delta between the level of protection after 1 dose or 2 doses, is that offset by maybe vaccinating a larger number of Canadians with just the 1 dose? And then, of course, once the vaccine supply becomes much more plentiful, being able to then offer, I guess, the full 2-dose regime to all Canadians. So those discussions are ongoing, and we continue to monitor the results of vaccination as it's unfolding across the country in terms of vaccine effectiveness. Thank you.
Thank you very much.
Thank you. Next question.
Thank you. Our next question is from Raymond Fignon de TVA. À vous la parole. Please go ahead.
Merci. Question pour le Major Général Fortin. Major Général, qu'est-ce que vous avez comme assurance que Moderna va bel et bien livrer 1,3 million de doses en 2 envois au mois de mars?
Inaudible.
Oui, alors,
Answer.
Moderna nous assure.
Listen, Moderna has assured us that the production will increase considerably over the coming weeks. They have assured us that they are in a position to meet their objectives of 2 million by the end of March, which clearly indicates that a major hike is required to reach that 1.3 million in March. We are in constant conversation with them, and they're already in a position to tell us that we'll be able to go from 3-week to a 2-week delivery schedule. Although we don't yet have the exact figures of what we'll receive by mid-March, the trend is higher. We're trending higher for the month of March. What we're hearing from Moderna, we have confidence in, and I feel I will be in a position to confirm the quantities by mid-March.
Ma question suivie pour le Dr. New.
Follow-up question for Dr. New. The Toronto Public Health Director said she's never been as concerned as she is today by the threat of the virus due to the variants. Do you share this concern? To what extent are you concerned? I think all public health authorities throughout the country, including myself and Dr. Tam, yes, we are all, how can I put it, concerned by these variants. We know what's happening in other countries. For instance, in the UK, we know that the variants that have already been identified are more easily spread. Of course, there may not be that much evidence as to how much more serious the actual disease can be. But it's possible, and it is up to us to follow up on what is going on with variants throughout the country. We have to redouble our efforts with our public health measures that have been successful, even in the UK. When you look at the community spread of the variants, when they imposed public health measures that were, how can I put it, there were also practiced with lockdown measures, etc. It is possible to stall or at least limit the spread of the variants. This is something we're looking very closely at here in Canada and following closely. At the same time, we are moving ahead with the vaccination effort. There's still many Canadians who are vulnerable to COVID-19, and we really need to continue along with good public health measures population-wide and also as individuals. Thank you.
Merci. Prochaine question.
Merci. Our next question is from Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Hi, yes. I'm wondering, maybe Dr. New, you could talk a little bit more about what evidence Canada has about the impact vaccines have had so far. We've seen some evidence that maybe long-term care outbreaks in Quebec have gone down. How are we collecting that evidence, and what evidence do we have, if any, that vaccines have had an impact on the spread in Canada so far?
Well, thank you very much for the question. What I think I mentioned earlier with some of the two authors who penned the New England Journal of Medicine, a sort of opinion piece. We've had good presentations because obviously in each of the provinces and territories, they're monitoring very closely what's happening with their vaccination efforts and also looking at what we call vaccine effectiveness as this being rolled out in settings such as long-term care facilities. And we've had presentations, they've done their preliminary analysis of the data, and the results are encouraging, showing that there is a good increase in terms of the level of protection for residents in these types of settings, even after one dose, as was alluded to earlier. However, I would say that at the national level, we've received these presentations, but I would certainly leave it to the I think the experts and the authorities at the provincial level to I think bring forward into the, I would say, the public domain the results of their specific studies that they've been undertaking in their own jurisdictions. Thank you.
Thanks, and I think this is probably for Major General Fortin. I'd like you to maybe go through the numbers that we're expecting in the spring again. I think you said 23 million doses now. And I'm wondering, when it comes to Pfizer, how much of that increase is because of the 6 doses Are we getting the same number of vials as we were supposed to get, but because of 6 doses, that's why they're saying we're getting more? Or are we actually getting more vials in the spring than we were expecting?
Yes, so we're getting more vaccine than initially anticipated in the second quarter, in the spring, brought from the quantity that we're expecting this summer. Some of that is brought forward, and all the vaccines that we were planning on receiving in the fall are now brought into the summer. So by September, we will have received 40 million doses of Pfizer product. So the 6 doses versus 5 is part of the calculus, but also additional vials of vaccines to make up for this considerable increase. But the takeaway here is that combined we'll have around 23 million vaccines in the spring. So you can see that we're now coming out of this period of limited supplies into an abundance of supplies spring and summer, where we can have a significant scaling up of immunization plans in provinces, and that will be the focus. That is the focus of our planning efforts right now, closely coordinating with provinces and territories.
Thank you. Follow up? Oh, actually, no. Next question.
Thank you. Our next question is from Kate Bolongaro from Bloomberg. Please go ahead. À vous la parole.
Hello. This question is about the different estimates for Q2. I'm wondering what are the comparison of the estimates that were released today versus the estimates that were given in January, and how the difference are.
Well, it's General Fortin here. I did not completely get the question. This was cut off. Comparison with January, but I'm not sure what the question was.
It was a question about Q2 and what are the differences between the numbers?
It's Dr. New here. We're having trouble hearing and understanding you. There's a lot of echoed feedback on your mic. Is it maybe possible? I don't know if you're using hands-free or using maybe getting closer to the mic so we can maybe better hear you.
Can you hear me better now?
There's still some echo. If you speak slowly, we'll probably be able to hear you.
Yeah. Okay. I'm wondering what is the comparison between the Q2 numbers published today versus the ones that were published in January, for example? What are the differences in the numbers and what are those due to?
Okay, it's General Fortin. I think if I understood the question right, what is the difference between the Q2 numbers that I'm now sharing, that we've been sharing lately, and what was initially published back in December, January? I think there's a couple of different things. First, data or quantities are confirmed by Pfizer and Moderna as we move forward. Pfizer is coming out of the retooling of their production line, and we see the results in numbers. The second part of this, of course, as discussed in the last couple of press conferences, we're moving to a 6-dose calculus as opposed to 5 doses per vial. So that also sees an increase in numbers. So specific to your point about what we published in January, this was with 5 doses per vial for Pfizer. And once the regulatory change was in effect, the week of February 15, we now calculate with 6 doses per vial, and that was reflected on what is now available on Canada.ca webpage.
Thank you. So,
go ahead. May I add? It's Ariane Reza from PSPC. If I could just add a follow-on to that. Just in terms of the net change between what we shared in December and now, I think we are up about 5.1 million doses expected in Q2 through negotiations with Moderna and Pfizer and some of the announcements from the Prime Minister and Minister Anand. Thank you.
Thank you. And for your follow-up, again, if you could just speak slowly and maybe just mute the feed, which seems to be in the background and cause some kind of echo.
I have no further questions. Thank you.
Thank you. So next question, prochaine question.
Thank you. Our next question is from Tunda McCharles from the Toronto Star. Please go ahead. À vous la parole.
Good morning. I'm not sure if you touched on this at the outset because it's the very, very top of your statement, but I wonder if you could speak to what the situation is with Astrazeneca. Not just the timeline for approval, but speaking of, the real world data that you're looking at, is Health Canada waiting on more real world data and how AstraZeneca is playing out in other jurisdictions now before it makes its decision on approval?
Hi, Tanda. It's Dr. New here. I think I answered your question. It has to do with sort of the regulatory approval for the Astrazeneca vaccine. Like I said, our Health Canada colleagues, the regulators, are still in the process of doing their due diligence. I understand that they're continuing to receive information and data from the Astrazeneca that would be important in terms of their analysis as far as their approval process is concerned. And other than that, I really don't have much more for you because obviously it's an independent process, and I'm not privy to what exchanges have taken place and what information data has been given to Health Canada regulators by AstraZeneca. Thank you.
In the past, you've been able to give us, though, some Health Canada, certainly at these briefings, been able to give us a picture of, is the data really the manufacturing side? Is it data, what kind of data you're waiting on? And so I'm quite unclear as to what it is you're waiting on. But just if I could just move on, if you have any clarification on that, that'd be great. If I could just ask your General Fortin, on your numbers, I think, am I correct in understanding then that the extra doses you anticipate getting between April and June is up from a 13 million base you had originally anticipated, or maybe if you could just enunciate original projection versus the most current projection. That would help, I think, some of us understand how you see this being an addition.
Yeah, I'll ask Ms. Reza to complete my answer, but what was recently announced is the bringing forward of 2.8 million doses from summer to spring. So that adds to the quantities that we had been working with of 8 million doses of Pfizer alone.
Anything to add? Anyone?
Yes, it's Ariane Reza from PSPC. Only to note, it is very difficult to give a timeline as the doses keep changing through active negotiation. But I think it's fair to say from what you've seen in December for Q2, we've advanced 5.1 million doses from Q3 and Q4 into Q2. So I'm trying to do the math here for you in terms of the initial amount. It was probably about 18 million doses initially for Q2, and now we're closer to 23 million doses.
Okay, thank you.
Thank you. Next question. Prochaine question.
Thank you. Our next question is from Evan Dyer from CBC News. Please go ahead. À vous la parole.
Good morning. This is a question for Dr. New. Obviously, older people, more vulnerable people typically have higher death rates from COVID, and that's the population that you're targeting first with this vaccination campaign. So I guess we would never expect the death rates to decline in a steady way, but rather to see a sharper decline in death rates and hospitalizations at the beginning. I just wonder if you could give us a kind of a picture as you look at the rollout and as you go through the different age bands and vulnerable groups of the population, when do you expect to see death rates and hospitalizations decline dramatically? When do you expect to get through those vulnerable populations that produce most of the hospitalizations and deaths from COVID?
Well, thank you very much for the question. And as you know, we've said this at our previous press conferences. Certainly, when you look at hospitalization and death rates, those are what we call lagging indicators. And let's say before vaccination, we would always say that it's usually several weeks afterwards in terms of people actually have been exposed and getting the virus before we might see whatever happens to hospitalization and deaths. In the case now with the vaccinations, they're rolling out quite well across the country. As I mentioned earlier, we're starting to get some preliminary data and the results of vaccine effectiveness from colleagues in the provinces and territories who have obviously started vaccinating residents in long-term care facilities. And the early indications are that it's starting to have an impact, that the rates of infection and then obviously subsequently the hospitalization and deaths as a result of sort of COVID-19 exposure and having the disease are starting to go down. But I think I would wait. Certainly, as time goes on, we'll have, I think, more robust data to be able to present to all of you. Thank you.
And I know that we're talking about a couple of vaccines that have not yet been approved, Novavax and Johnson & Johnson and so on. But how do you see, assuming that they are approved and that they become part of the program, how do you see the different vaccines being used in different settings or with different populations? Are there some vaccines, for example, that we should expect to see going to more remote areas, or some vaccines that you might hold back for younger, less vulnerable populations? Would there be some vaccines that would be more suitable for some things, and what would they be?
Yes, a very good question. As I think we've mentioned earlier, certainly with the advanced purchase agreements we have for a range of vaccines, ideally, I think in Canada we would, in a few months or so, have what we call a suite of vaccines, and they would all be part of, I would think, our overall vaccine strategy. The first two vaccines, as we've mentioned previously, especially the Pfizer-BioNTech vaccine, had some logistical challenges, issues, especially with our geography here and sort of the very stringent cold chain requirements. But you can see that the other vaccines which are not yet approved, but if they were to be approved, would be much easier to handle. More at sort of a regular sort of refrigerator temperatures, and in that sense, the existing infrastructure that we have for vaccination, such as for influenza vaccination, could be brought to bear. So through pharmacies and doctors' offices and so on, I think it would be much easier to vaccinate a much greater number of Canadians. So those are the kind of factors we're looking at. One of them is logistical. The other part also is that we need to look at the profile based on the clinical data, the trial data that's been submitted to the regulator. I can't speak for the regulator in terms of what they might actually approve the vaccine use for. Then maybe there might be a very specific recommendations in terms of what the specific vaccines are approved for. So I can't get ahead of that. The other part, though, is that we would also look, obviously, to our National Advisory Committee on Immunization, the experts who obviously look at the data, the evidence, not just based on what the company submits, but also I would think the experience around the world, maybe if the vaccines are already being used in other parts of the world. And that would also, I think, inform them in terms of their recommendations that he would put forward in terms of specific vaccines and how they might be best used as part of an overall vaccine strategy. You're right, maybe for certain vaccines, it may be for a whole host of reasons, maybe better, more appropriate to vaccinate or use them in certain at-risk groups as opposed to other at-risk groups. Thank you.
If I could add, even just to complete the answer, the work that we're doing now with provinces and territories in terms of planning for phase 2 for the ramp up in the spring, mostly with provinces, of course, and federal populations, it is about more Pfizer, more Moderna, but also those potential vaccines as they come online, and what that means. And those vaccines that are 2 to 8 degrees, so that use normal or cold chain requirements that are closer to what the provinces are used to. The provinces are aligning themselves on that. They have plans to leverage their pharmacies and their own distribution systems the way that they use them for influenza vaccines. So there's a lot of planning happening in the background. Notwithstanding NACI advice as to who should get which vaccine, we're planning on bringing those vaccines in Canada and distributing them across the country.
Thank you. Merci, opérateur. Next question.
You. Our next question is from Ryan Timothy from the National Post. Please go ahead. À vous la parole.
Yeah, hi there. I'm wondering, as we move into this second phase, into this ramp up, how equipped are we for storage when it comes to vaccines in case provinces start to experience a backlog and being able to administer them for whatever reason? Maybe people aren't showing up for their appointments or issues like that. I'm wondering how much capacity we have for storage, and at what point does our capacity for storage impact our deliveries? What point would companies stop delivering to us if we have too many in storage?
Yes, so it's General Fortin here. I think there's a couple of different aspects to your question. First, we have storage capacity in country right now, but they may not be at the right location for those types of vaccines that require minus 80 or minus 20 freezers. So more freezers are being procured. The orders have been placed some time ago, and they will be delivered in the next weeks. They will be brought to us as rapidly as they can be produced. So we'll be pushing them as planned to provinces and territories, and we'll continue to adjust those plans with the provinces as they see those numbers, those vaccines in their projections. And they will reprioritize the location of those freezers, and will ensure that that's well coordinated. In addition, there are other cold chain enabling equipment such as the Credo cubes and dry ice and all of that completes the cold chain requirements. The other aspect of your question is about throughput, and that in addition to the cold chain enabling the freezers and of the different types that are being procured, the provinces and territories are looking at ways to increase their capacity to immunize with the health workforce. And they are looking at non-traditional immunizers. They're looking at onboarding the pharmacies and various other capabilities to ensure that we have the right, the most optimal system in place to deliver vaccines as rapidly as safely as possible.
Thanks. Follow up?
Yeah, and so just I'm wondering if there's anything in our contracts with the vaccine companies about them suspending shipments if we are not using the vaccine.
Sorry, thank you for the question. Discussions with vaccine suppliers are ongoing. We, of course, work very closely, and, we work with them to be able to demonstrate that Canada has the public health backbone for the distribution and the health professionals available to administer it. Thank you.
Thank you. Next question.
Thank you. Our next question is from Paul Vieira from the Wall Street Journal. Please go ahead. À vous la parole.
Hi, can you hear me?
Yes, we can.
Okay. Moderna is seeking to put some additional vaccine in each vial, which would require a retooling at its plants that could take up to 10 weeks. Has Moderna discussed with Canadian officials possible delays in shipments to this retooling as in an attempt to put more vaccine in each vial?
It's Dr. New. I can speak. Yes, I have no personal knowledge of that. That obviously is a bit of a, I would say, a logistical issue, and I can't speak for the regulators. So at this point, I really have nothing to add from a public health perspective. Thank you.
No, what I'm asking is whether or not Moderna has advised of possible delay in shipments as it retools plants to put more to possibly put more vaccine in each vial.
Thanks for the question. This is Ariane Reza from Public Services and Procurement Canada. While we discuss with Moderna and Pfizer and all the suppliers almost on a daily basis the overview of their production and meeting their delivery quotas, this particular issue has not been raised by Moderna. Thank you.
Thanks, Paul.
Yeah, thanks.
Any other questions, Paul?
No, go ahead.
Okay. So, operator, we may have time for one more set of questions.
Certainly, thank you. Our next question is from Tanda McCharles from the Toronto Star. Please go ahead. À vous la parole.
Yes, hi, Dr. New. Can I loop back to your comments around, you think it's interesting that there is data to show that, the effectiveness of the vaccines after one dose is possible, and that offsetting the ability to vaccinate more widely in vulnerable populations. Is that something that you're saying Health Canada is actively considering for Pfizer and or Moderna?
Well, I can't speak for Health Canada. I'm with the Public Health Agency of Canada. So from a public health perspective, we've been having active discussions with our counterparts in the provinces and territories with the Special Advisory Committee. I think, it still stands with the official product monograph. Ideally, I think the maximum protection based on their clinical trial data is for individuals to receive a two-dose regimen, with a certain interval. As we've mentioned previously multiple times, right now we're in a period of what we call relative vaccine scarcity. And so with sort of a scarce vaccine supply, the issue comes in terms of how might the interval be adjusted. And we've spoken to that before. Certainly where we're getting closer to the spring, to April, when we anticipate getting many more millions of doses of vaccine. However, in the meantime, based on early data from the provinces and territories, what's happened in terms of vaccine effectiveness among individuals receiving even one dose, the level of protection is very high. And so the question is, in terms of from a public health perspective, looking at the interval, of course, we would like to vaccinate everyone with two doses. But in the meantime, what should we do? Should we consider, maybe vaccinating more people as we have these doses come into Canada with the one dose and protect a larger number of people, and of course, eventually do the second dose for those people. But in the meantime, maybe not strictly following and saying it has to be two doses for a smaller group of people as opposed to a larger number of people receiving one dose. So that type of discussion, I think we've mentioned was there even several weeks ago, but certainly now as the data is coming forward and we're getting good results based on what some of the provinces and territories are telling us, it's something to keep looking at. Thank you.
And how would you describe, you say these are live discussions at the Special Advisory Committee, and so I assume that's with all the chief medical officers of health or public health officers across the country. How would you describe that discussion? Is there, do you sense that there's a real desire on their part to do just that, to vaccinate more widely and, eventually deliver second doses, but, get it out the door while you can?
Well, I can't really speak for individual chief medical officers of health. I think you'd have to go to them individually.
I'm sorry.
Well, the thing is, it's a group discussion.
The tenor
Hold on.
of the discussion, sir.
Tunda, can you make sure what your question is? Go ahead.
Yep. I just say, I think
the general tenor. Thank you.
The general tenor. Well, I think I think the chief medical officers of health, I think, are very interested looking at all of the science. And as I said, that the data is just coming in. So with preliminary data coming in with some encouraging results, I think it's a good discussion. I would say also that there's so many other factors in play, as we just mentioned earlier. Other things that the chief medical officers of health are also looking at in terms of an overall vaccination strategy in their own jurisdictions is that, if other vaccines become licensed like Astrazeneca, what would be the appropriate use in place in terms of the planning for a vaccine rollout? So there are lots of other factors beyond just the two vaccines that are currently approved and, what we could or should be doing in the next several weeks. As I said, we're anticipating many more millions of doses coming, I think, in the second quarter, which is not that far off. It's still a few weeks away, but those are the kinds of things that we're looking at. So in the meantime, I would defer to the individual chief medical officers of health and as well as, others in their own jurisdictions and making sure that looking at the data, what makes sense for them, what their final plan might be in terms of what they do now for the vaccine rollout based on the evidence that they have. Everyone can look at the evidence and obviously based on local and provincial context and make their own respective decisions.
All right. Thank you. Merci. This is the end of the technical briefing. C'est ce qui me fait à ce briefage technique. Merci. Bonne journée.
Merci.
Bye-bye.